Across Georgia, salons and barbershops and other businesses reopened Friday morning after Governor Brian Kemp defied public opposition from the president, public health experts, and some mayors in his state. Lines started forming around 7 a.m. and snaked around some businesses. Mr. Kemp's order generally allowed barbershops, nail salons, gyms, bowling alleys, and tattoo parlors to reopen on Friday. Dine-in service at restaurants will be allowed to resume on Monday. The move to reopen in Georgia on Friday, along with similar plans in Oklahoma and Alaska, is being closely scrutinized as other governors consider future steps for their own states. After initially backing the Georgia governor's plan, President Trump on Friday denied that support and said some businesses in the state should take a little slower path. Mayor Keisha Lance Bottoms of Atlanta urged people to stay home. "Listen to the scientists," Ms. Bottoms said Friday on ABC's Good Morning America. "There is nothing essential about going to a bowling alley or getting a manicure in the middle of a pandemic." But on Auburn Avenue, a historic African-American commercial strip in Atlanta, a long line formed early Friday at a herbal and tonic bar that was set to open. A hair salon in the same center, though, remained closed. Oklahoma was also scheduled for a wave of reopenings on Friday when salons, barbers, spas, and pet groomers will be allowed to reopen in parts of the state by appointment only. Other pieces of the state's economic engine, including restaurants, gyms, and places of worship, are scheduled to reopen as soon as May 1. In Georgia, government statistics show the state has recorded more than 21,800 virus cases and that at least 881 people have died. The pain in Georgia has not been spread evenly. In rural Dougherty County, which includes Albany, officials have reported nearly 1,500 known cases and 109 deaths. Authorities found that a funeral for a retired janitor that brought more than 200 people into a small memorial chapel in Albany, a city of 75,000 people and the county seat, was the source of the outbreak. Chatham County, which includes Savannah, and which has more than twice as many residents as Dougherty County, has 199 known cases and 6 deaths. The most overall cases are concentrated in the Atlanta area. But the highest per capita rates are in the state's southwest. In addition to Dougherty County, the situation has been notably bleak in Sumter, Lee, Mitchell, Early and Terrell counties. Black Georgians make up a plurality of cases and deaths, even though they account for only about 1/3 of the state's population. In a series of tweets on Thursday night, Mr. Kemp said the state had been successful in our efforts to protect Georgians and our state's health care infrastructure. Now, with favorable data and approval from state health officials, we are taking another measured step forward by opening shuttered businesses for limited operations, he continued. I know these hard-working Georgians will prioritize the safety of their employees and customers. Mr. Trump's criticism on Wednesday and Thursday has baffled Mr. Kemp and Georgia Republicans. It has also sent a confusing message to other state and local officials who are considering similar moves. The result is that governors across the country, even those allied with Mr. Trump, are all but forced to pay close attention to the administration's guidance on the timing of opening up their economies. And that guidance, critics say, is all over the place. Even as some hairstylists were readying workspaces for their first customers in weeks on Friday morning in Georgia, others said they would stay home, afraid of spreading the virus to clients. In Atlanta, Lindsay Maxfield, 33, a hairstylist, said she was glad her workplace, Cameo Salon, would remain closed. Having people come to the salon is ridiculous, she said. Mr. Trump is expected to sign a $484 billion relief package on Friday, providing a much-needed lifeline to small businesses, as well as funding for hospitals and testing. In the past month, Congress has approved an astonishing $2.7 trillion in response to the pandemic. The latest measure, however, contained no money for state governments, and governors have stepped up their calls for federal assistance. Republicans have resisted providing money to the states, what the Senate Majority Leader, Mitch McConnell of Kentucky, called blue state bailouts, even as local governments have been overwhelmed by an explosion of unemployment claims, with more than 26 million people losing their jobs in just 5 weeks. The federal government is kicking in an extra $600 per beneficiary, but states must pay the bulk of unemployment benefits using trust funds. At least 3 states, California, New York, and Ohio, are expected to deplete their trust funds within 2 weeks, with Massachusetts, Texas and Mr. McConnell's state of Kentucky close behind. Once those funds run out, the states can borrow money from the federal government, but must repay it within 2 years. And nearly a month after Washington rushed through the first emergency package to aid jobless Americans, millions of laid-off workers have still not been able to apply for those benefits, let alone receive them, because of overwhelmed state unemployment systems. Delays in delivering benefits, though, are as troubling as the sheer magnitude of the figures. Such problems not only create immediate hardships, like not being able to pay rent or buy food, but also affect the shape of the recovery when the pandemic eases. The number of jobs lost in 5 weeks is roughly the equivalent of the workforces of 25 states. Transcript. So we have undertaken the largest, most comprehensive study of New York State to find out what is the infection rate. And that we started a few days ago. Sample size, so far, 3,000 people statewide. Let's find out what the infection rate is. We have preliminary data on Phase 1, and this is going to be ongoing. We did about 3,000 tests. But what we found so far is the statewide number is 13.9% tested positive for having the antibodies. What does that mean? It means these are people who were infected, and who developed the antibodies to fight the infection. Long Island at 16.7, New York City at 21.2, Westchester/Rockland, 11.7 and rest of state, 3.6. This basically quantifies what we've been seeing anecdotally, and what we have known, but it puts numbers to it. It changes the theories of what the death rate is. If you get infected, 13% of the population is about 2.7 million people who have been infected. If you look at what we have now as a death total, which is 15,500, that would be about 0.5% death rate. 1 of every 5 New York City residents has tested positive for antibodies to the coronavirus, according to preliminary results described by Governor Andrew M. Cuomo on Thursday, suggesting that the virus had spread far more widely than known. If the pattern holds, the results from random testing of 3,000 people raised the prospect that many New Yorkers, as many as 2.7 million, the governor said had been unwittingly infected by the virus. Mr. Cuomo added that such an elevated infection rate would seem to show that the death rate was far lower than believed. While the reliability of some early antibody tests has been questioned, researchers in New York have worked in recent weeks to develop and validate their own antibody tests, with federal approval. State officials believe that accurate antibody testing is a critical tool to help determine when and how to begin restarting the economy and sending people back to work. The testing in New York is among several efforts around the country to determine how many people may have already been exposed to the virus, beyond those who have tested positive. The results appear to conform with research from Northeastern University that indicated that the virus was circulating by early February in the New York area and other major cities. In California, a pair of studies using antibody testing found rates of exposure as high as 4% in Santa Clara County and 5% in Los Angeles County, higher than those indicated by infection tests, though not nearly as high as found in New York. In New York City, about 21% tested positive for antibodies during the state survey. The rate was about 17% on Long Island, nearly 12% in Westchester and Rockland counties, and less than 4% Indiana, the rest of the state. A detailed county map shows the extent of the coronavirus outbreak, with tables of the number of cases by county. The president asserted, without any scientific evidence, at his daily White House briefing on Thursday that sunlight, ultraviolet light, and household disinfectants could possibly kill the coronavirus inside the body. Experts have long warned that ultraviolet lamps can harm humans if used improperly when the exposure is outside the body, much less inside. The link between ultraviolet light and skin cancer is well established. Bleach and other disinfectants may kill microbes, but they also can kill humans if swallowed or if fumes are too powerful. That is why bottles of bleach and other disinfectants carry sharp warnings of ingestion dangers. The president's theorizing on Thursday came after a scientist, William N. Bryan, the head of science at the Department of Homeland Security, told reporters at the briefing that the government had tested how sunlight and disinfectants, including bleach and alcohol, could kill the coronavirus on surfaces in as little as 30 seconds. Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, Mr. Trump said. And I think you said that hasn't been checked, but we are going to test it, he added, turning to Mr. Bryan, who had returned to his seat. And then I said, supposing you brought the light inside the body, either through the skin or some other way. Apparently reassured that the tests he was proposing would take place, Mr. Trump then theorized about the possible medical benefits of disinfectants in the fight against the virus. And then I see the disinfectant where it knocks it out in a minute, 1 minute, and is there a way we can do something like that by injection inside, or almost a cleaning, he asked. Because you see it gets in the lungs and it does a tremendous number on the lungs, so it would be interesting to check that. The White House on Friday sent a corrected briefing transcript, which initially misrepresented a response from Deborah L. Birx, Mr. Trump's coronavirus response coordinator. In the earlier version, sent Thursday night, after the president suggested treating the coronavirus with light and heat, Dr. Birx is quoted as saying, "That is a treatment." The corrected version clarified that Dr. Birx actually said, "Not as a treatment." Shortly after, the White House also accused news organizations of taking the president's comments out of context. President Trump has repeatedly said that Americans should consult with medical doctors regarding coronavirus treatment, a point that he emphasized again during yesterday's briefing, the White House press secretary, Kayleigh McEnany, said in a statement. After the president's comments on Thursday, searches soared for cleaning products like colored laundry detergent capsules, or Tide Pods, leading the Washington State Emergency Management Division to tell people, don't eat Tide Pods or inject yourself with any kind of disinfectant. The maker of the disinfectants Lysol and Dettol also issued a statement on Friday warning against the improper use of their products. As a global leader in health and hygiene products, we must be clear that under no circumstance should our disinfectant products be administered into the human body, through injection, ingestion, or any other route, the company said. The words "under no circumstance" were highlighted in bold. Stocks on Wall Street rose in early trading on Friday, even as shares in global markets slipped, as a week of dramatic turns in the financial markets came to a close. The S&P 500 rose about 0.5% in early trading. Shares in Europe were slightly lower, and Asian markets also had a down day. But the focus among traders in the U.S. this week has been oil prices after the American benchmark for crude crashed into negative territory on Monday, an unprecedented move that broke through the relative calm that had settled over financial markets. On Tuesday, stocks suffered their sharpest drop in 3 weeks after the dive in oil prices, and even after rebounding slightly, the S&P 500 is still on track to end the week with a drop. Still, stocks are subject to sudden changes in sentiment or reversals in efforts to reopen economies. Economic and corporate data continues to outline the toll the virus has taken on the global economy, and American officials emphasized that recovery would be difficult. On Friday, new data showed that the near shutdown of the economy has pushed U.S. manufacturing into free fall. And even as some companies begin to consider reopening factories, they face opposition in some quarters. For example, the United Automobile Workers Union said on Thursday that it was opposed to companies restarting auto production next month, saying it was not yet safe for its members to return to work. Lawmakers in Washington continue to advance measures to support the economy. Mr. Trump is expected to sign into a law on Friday a $484 billion package that would revive a depleted loan program for distressed small businesses and provide funds for hospitals and testing. Oil prices continued to find a footing, climbing slightly. Still, they remain near historical lows amid concerns about oversupply. In January, a mystery illness swept through a call center in a skyscraper in Chicago. Close to 30 people in one department alone had symptoms: dry, deep coughs and fevers they could not shake. When they gradually returned to work after taking sick days, they sat in their cubicles looking wan and tired. "I've started to think it was the coronavirus," said Julie Parks, a 63-year-old employee who was among the sick. "I may have had it, but I can't be sure." The revelation this week that a death in the United States in early February was the result of the virus has significantly altered the understanding of how early the virus may have been circulating in the country. Researchers now believe that hidden outbreaks were creeping through cities like Boston, Chicago, New York, and Seattle in January and February, weeks earlier than previously known. The new timeline has lent credence to a question on the minds of many Americans: did I already have the coronavirus? The retroactive search is happening on many levels. People who had suffered dreadful bouts with flu-like illnesses are now wondering if it was the virus. Doctors are thinking back to unexplained cases. Medical examiners are poring over their records looking for possible misdiagnosed deaths. And local politicians are demanding investigations. "I think it was here long before we knew it," said Brian Gustafson, a coroner in Rock Island County, Illustrated. "That's the only logical thing I can think of." Included in Mr. Gustafson's suspicions of an undercount, himself. Thousands of inmates have been freed across the country in an effort to slow the virus's spread behind bars, and advocates have filed lawsuits seeking the release many more incarcerated people as outbreaks in the nation's jails continue to grow. But as more inmates have walked free, the releases have prompted a growing backlash. "It's a slap in the face," said Tracy Fehrenbacher, who recently learned of the release of the man charged in connection with her daughter's death in a hit-and-run. The debate over who should be let out has become fierce in some places. In Texas, Governor Greg Abbott issued an executive order barring the release of some inmates, arguing that it would not only gravely threaten public safety, but would also hinder efforts to cope with the COVID-19 disaster. In Washington state, some law enforcement officials argued that a plan by the governor to grant early release to nearly 1,000 inmates could include people who had committed assault and sexual crimes. Many opponents have pointed to Florida, where a Tampa man was accused of shooting and killing someone the day after he and more than 160 other inmates were freed from Hillsborough County jails last month. "Releasing inmates carries risks," acknowledged Miriam Krinsky, the executive director of Fair and Just Prosecution, a national network of progressive prosecutors. "But leaving things the way they are would cause even more harm," she said. More inmates and employees would be infected in crowded facilities, and because of the high turnover rate in local jails, would then carry the disease into the community. "Doing nothing is going to ensure that there will be tens of thousands of additional deaths," she said. With congressional approval of the latest emergency pandemic measure sealed on Thursday, the focus is quickly shifting to an escalating battle over whether Congress will provide hundreds of billions of dollars to states staggering under the costs of the outbreak. Anxious governors have been clamoring for more federal help, saying that their budgets are being stretched to the breaking point and that their revenues are collapsing as they pour resources into health care while their economies are shut down. But the latest measure contained no new state aid, and Senator Mitch McConnell, the majority leader, alarmed and angered state officials this week when he said he wanted to approach the next round of pandemic legislation more deliberately. Rather than looking for handouts, Mr. McConnell said, the states should consider filing for bankruptcy. His aides threw fuel on the fire in a news release that said the Senate leader was opposed to blue state bailouts, suggesting it was Democratic-leaning states that were seeking the money to take care of problems caused by fiscal mismanagement. New York's Governor, Andrew M. Cuomo, seemed gobsmacked by the concept that his state should even consider declaring bankruptcy. "That's how you're going to bring this national economy back?" asked an incredulous Mr. Cuomo, who called Mr. McConnell irresponsible and reckless. "You want to see that market fall through the cellar? Let New York State declare bankruptcy." Republicans on Capitol Hill say they believe that Mr. McConnell, who opposed new state aid in talks that produced the most recent measure, was trying to reassure restive conservatives that he would not give in easily on more funding in coming talks after Congress had already allocated about $2.7 trillion in deficit spending in response to the emergency. But Mr. McConnell faces significant obstacles if he intends to block the aid, given the extent of bipartisan support for more state relief. "Our lives have been forever changed by the pandemic. Hundreds of thousands of people around the world have died. Millions in the United States alone have lost their jobs. Though the outbreak was declared a pandemic just over a month ago, many of us are already feeling nostalgic for our lives before the virus went global. We asked you to send us photographs and videos that captured those moments of normalcy. We received nearly 700 submissions from all over the world, including from Milan, Mumbai, India, Paris, Wuhan, China, and places across the United States. Nearly every submission expressed a sense of gratitude and appreciation for the time before the pandemic. Many also conveyed worry and a longing to feel a sense of safety and normalcy again." Even as the European Centre for Disease Prevention and Control announced that the first wave of virus transmission had passed its peak in 20 members of the European Union, Britain was still struggling to get ahead of the virus. The nation was behind many others in Europe in putting in place restrictive social distancing measures, with the British government frequently saying it was guided by the science. With the country approaching 20,000 deaths, The Times correspondents Mark Landler and Stephen Castle took a look at the secretive scientific group advising the government. As the British government comes under mounting criticism for its response to the coronavirus, one that has left Britain vying with Italy and Spain as the worst-hit countries in Europe, Prime Minister Boris Johnson and his aides have defended themselves by saying they are guided by the science. The trouble is, nobody knows what the science is. The government's influential Scientific Advisory Group for Emergencies, known by its soothing acronym, SAGE, operates as a virtual black box. Its list of members is secret, its meetings are closed, its recommendations are private, and the minutes of its deliberations are published much later, if at all. Yet officials invoke SAGE's name endlessly without ever explaining how it comes up with its advice or even who these scientists are. That lack of transparency has become a point of contention, as officials struggle to explain why they waited until late March to shift from a laissez-faire approach to the virus to the stricter measures adopted by other European countries. Critics say the delay may have worsened a death toll now surging past 20,000, and they fault the government for leaving people in the dark about why it first chose this riskier path. Reporting was contributed by Alan Blinder, Eileen Sullivan, William J. Broad, Sarah Mirvash, John Elegon, Dan Levin, J. David Goodman, Michael Rothfeld, Julie Bossman, Patricia Cohen, Richard Fawcett, Amy Harmon, Carl Hulse, Rick Rojas, Thomas Fuller, and Mark Santora.